I'll go ahead and get started. So first off, my name is John Goodsmiedel. I am a UD grad, class of 2019 and class of 2020. I graduated with a master's and bachelor's in computer science along with a minor in Spanish. I was a member of EMS for 3 years and a crew chief for my last year. I also have experience interning with Dayton's fire department and am currently going through the probationary stages of a volunteer department back where I live in Virginia. And my full-time job is using my computer science major working for General Dynamics. So thank you everybody for coming. Few quick things before we start. Thank you for all those who have submitted questions in advance. We will do our best to address those, as well as to address any questions that come up live after our presentation. Today is part of a webinar series that happens every Wednesday at noon during the month of October. We will post the link in chat to anybody that's interested in viewing or participating in any upcoming sessions. This is being recorded and will be uploaded to UDigital in the next week or so it will be available to the public. And today's session, as you may guess by my affiliation, will focus on UD EMS, or University of Dayton Emergency Medical Services, and how they've adapted this semester to all the changes with COVID and being in and out of class, and how they continue to build the community here on campus. So with that, I'm going to turn it over to UD EMS Chief, Bodie.
Hi, everyone. Before we get started, I'd like to start with some introductions here. My name is CJ. I'm a senior. I'm the current chief of EMS. I'm joined by 3 other seniors, Eric Prayson, Julia Scanlon, and Chloe Dillinger, and then Junior Bailey Cox. Before we get into the presentation, I would just like to preface this. Eric and I are both on shift right now, and in this small window that we're presenting, if we happen to get toned out, you'll hear a bunch of noises and then we'll just both get up and leave. I'm very sorry in advance if that does happen. Bailey will be taking over and finishing the presentation, but hopefully that won't happen. So let's go ahead and get started. Okay, so let's see. So who are we as UD EMS? We are an entirely student-run organization of 61 emergency medical technicians. The EMT certification is a nationally registered certification. So when we finish our course in the fall semester of the first semester that we've joined EMS, we have the same exact certification that anyone that works at your local firehouse would have if they're an EMT. As you guys can see here in our images on the right, our members will take the certification and work in private agencies over the summer. So in the top right, we have Hannah Urich, who's also a senior. She's working at a fire and rescue company in Cleveland. And in the bottom right, you have Sarah Pierce working for the Ohio Ambulance Corps down in Cincinnati. So we take the certification we get and use it for a lot of different things. As EMTs, we have the ability and jurisdiction to respond to any medical emergency on UD's campus the entire time we're in service. So this involves students, faculty, and any visitors, as long as it's inside the UD campus borders. Starting at 6 p.m. on the Friday of welcome weekend all the way through 5 p.m. of finals week, we are in service 24/7. So any medical emergency that arises on campus, we will respond as long as it's, like I said, in those UD borders. So administratively, we are led by 11 student officers that each handle a different organization need. And I cannot stress this enough. I could not do my job without the help of every single one of my officers. We're joined by 2 officers here in Chloe and Eric. Eric is the Assistant Chief of Operations. I'm sorry, not Chloe, Julia. Eric is the Assistant Chief of Operations, and Julia is my Public and Alumni Relations. Each of these positions handle a different need. So some deal with our medical documentation and the legality of us writing run reports. Others handle more relations with the police department, and others work with UD's administration and the Dayton Fire Department. But like I said, we need all 11 of us to make sure that this organization is running up to standard. We all also work together to liaise our way to the National Council of Collegiate EMS Organizations. This just encompasses all of the student-run programs throughout the United States, all around 250 of us. So on shift, we have a little bit different of a hierarchy. This image on the right is a pretty standard care response team for us. In the center, we have our crew chief, and then on his left and right, we have 2 assisting crew members. So like I said, at any time, we're going to have 3 members working in that the whole time we're in service, and the crew chief is essentially our chief medical officer on shift. So they're going to make all of the medical decisions for the patient, and ultimately the patient's care during our care is their responsibility. Members get to be a crew chief once they've run a significant number of calls, including some minor calls and then some more major ones, like maybe a heart attack or a gruesome seizure. And then off calls, they're tasked with mentoring crew members so that they can potentially get to that CC role at some point. One of the things that is a characteristic of EMS is a high member turnover. Obviously, we have seniors graduate every single year, which means that we really need to always be working on passing our information down and making sure that we can continue our care once the seniors leave and that leadership is gone. One of the ways that we pass things down is through probably a lot of members' favorite parts of EMS, and that's training week. So before everybody gets to move in the fall, we get to move in a week early so that we can have a week of just focusing on training while not being in service and serving the UD community. So in the mornings, we have continued education lectures from physicians from Miami Valley or even other parts of Ohio, like Columbus and Cleveland. They cover any sort of pre-hospital information that we might need to learn. And then in the afternoons, we schedule 6 to 8 hours of training calls that range all the way from full codes with the cardiac arrest to major psychological episodes to people falling off the roof or getting shot. And we stage these safe yet very instructive and intense scenarios so that our members can kind of jump back into the care providing scenario before going on an actual call. At the very end of the week too, we get to set up a mass casualty incident or an MCI. Over here on the right, we have 2 images from MCIs that we've set up during these training weeks. So in the top right, I think 3 or 4 years ago, we staged an MCI at Tim's. And it's really awesome because our members get to all respond as an organization and sort which patients need immediate help, which ones can be delayed a little bit, and go through all the things that are required in an MCI. And it's a really great way for us to prepare this should it ever arise on campus. In the bottom right too, our victims also get to have some fun too. We get to moulage them up with fake injuries so that it is, like I said, a little bit more of an intense and a better training opportunity. Okay, so this is also probably one of my favorite parts of EMS, and it's the fact that we're a big family. So this image on the right here, it's kind of hard to see without all the people moving, but this is mentor-mentee speed dating. So less than a month after joining EMS, all of our new members, so around the 20 to 24 that we accept, begin that certification process, but they don't do that alone. And I like to think that although these sophomores and juniors are the ones getting certified, essentially the entire organization is getting recertified every single year. Because although the already certified members aren't going through the testing again, they are working with all these new members to make sure that they're getting all the information they need to pass these tests. So like I said, this mentor-mentee speed dating, you get assigned an already certified mentor, and they're our #1 resource to help prepare for the 4 written and 1 practical certification test that the new members will have to take between the end of November and February. So it's a lot of work for these new members, but like I said, they don't do it alone. We're there for them every step of the way. Just to touch on this again, though, like I said, we have very high member turnover. So making sure that we have seniors can pass all the information down to the juniors and sophomores and continue on this instructive process once we leave is probably one of the most important parts of what we do. And that's really, really possible through our mentoring program. So just to talk a little bit about our history. So we started in 1992. A few public safety cadets thought that having some sort of first aid response on campus would be very helpful. So they essentially gave some students a van with a bunch of first aid supplies and said, from 7 p.m. Thursday night to 7 a.m. Sunday, you guys are going to do whatever first aid you can. There was no formal first aid training. It was essentially lifeguards and other first aid that they had, and they would respond to anything that they could handle on campus. Our home station was in the UD PD station down in Fitz, but soon that changed in 1993 when we got our first 7 EMTs certified through the UD EMS title. Back then it was called Rescue Squad, but now we're UD EMS. We were also donated a used 1978 Chevy ambulance, which we used for a long time until, as you guys see, in 2012, we got a new ambulance. In 1994, we were donated our 214 Longview address, which is really cool because we still, although we have a new house, we're still located at 214 Longview, which is pretty great that we get to carry on that legacy from the very beginning. So in the next slide, we have a couple pictures of our history. So in the top right, you can see that's our brand new ambulance in front of the iconic chapel. In the bottom right, that's the house that we currently have. And you can see in the picture directly to its left and above it, they all have the garage. And we're actually, I believe, the only UD house that has a garage, which is pretty awesome for us. That's where we keep our ambulance. That's where we keep a lot of medical records. And that's where we keep a lot of supplies. As you guys can see, our original house was very small, and it was demolished in 2016. And we were given a brand new house for the following year. And that is the house that we still use today. Okay, so some medical highlights. Although most of our students on campus, we're healthy 19 and 20-year-olds, we do still get a lot of calls in way different varying scenarios. So we have lots of seizures, we see heart attacks, drug overdoses, broken bones, and pretty much everything in between. In February of 2019, we actually did receive the Sudden Cardiac Arrest Award for saving a life after responding to an arrest earlier that year. So members of UD EMS responded to a patient that had gone into a full cardiac arrest. They started CPR, they ran the full code, and they actually got a pulse back and saved that life. So that was a really big honor for us because that was one of the more intense calls that UD EMS has ever gotten. Over here on the right in that image, you guys can see this is a newspaper cutout that is actually hung up in the house. But this is when we got our first organization of the year, which we're going to get to in a second. So let's just go and talk a little bit about our achievements. So like I said, our officers' goal is to liaise our way to this National Collegiate Emergency Medical Service Foundation. And through this, we go to an annual conference every year. In the past 2 years, it's been in Boston and Pittsburgh, and it's really awesome because our officers get to travel to these locations and essentially present all the work that we've done as an organization in the past year. We present them all that organization, and then they decide which of the organizations were the best and give out the various awards they have. So of the 250 student-run organizations, we have won Organization of the Year 3 times, EMS Week of the Year 5 times, and we were the first and only organization so far to win the Community Engagement Program of the Year last year. And I think that that's really, really cool. And I want to talk on that too, because one of our main focuses of EMS is to make sure that we're helping people other than just our organization, other than just our students. We want to try to involve surrounding people who live in Dayton in our CPR and first aid classes, and also kids whenever we have them on campus. So in the top right picture, you can see some kids chilling in the ambulance during family week. They get to family weekend. They get to come in and see the ambulance. We can show them the stethoscopes, and they get a little taste of what UD EMS is. And in the bottom right, during Christmas on campus, any of the kids that come visit for that night can come and listen to their heart, or they can listen to the heartbeats of their stuffed animals, as you see here. They're usually a little more interested in the stuffed animals, but that's besides the point. So now this is probably the question that everybody wants to know, is how COVID has affected EMS. And in all honesty, it hasn't changed our work all that much. When we've been back on campus, we've been wearing two masks on every call. We wear that super protective N95 as well as a surgical mask on all of our calls. And then when we get into the call scenario, we ask the patient or any bystanders if they've had an exposure or if they are COVID positive, and if they are, we go in and put on a full gown and a face shield. But other than that, it's pretty much the same exact care that we would provide. One other opportunity that we have gotten to have, though, is that we are volunteering off shift to provide transports to COVID positive students. As I'm sure all of you alumni are aware, we had a pretty significant spike in August and September with COVID cases, and the Environmental Health and Safety Department got a little overwhelmed with how many students they needed to get out of their housing into isolation. So they reached out to us, and we were able to start helping the university provide transport to these students. We have members volunteer off shift. They go and get a university vehicle, and they take these COVID positive students to either the Marriott, Marianist, or Irving Commons for isolation so that they can spend those 14 days without infecting anybody else. This has been a really great way for us to get involved in the COVID response outside of just providing care on shift. We're looking for everything and anything that we can do to help UD respond to the COVID emergency. Just to wrap things up, at the heart of it, we are just 61 people that want to give back to UD because we understand that UD has given us a whole lot. We just want to keep UD students, faculty, and visitors safe at all, and take care of this community that's been giving us so much our 4 years here. So with that, we'll go ahead and open it up to some questions. We're more than happy to answer anything you have, and we really appreciate you guys listening to us.
All right, thank you, CJ. That was a great presentation. So as he said, if you guys want to use the Q&A function, we will start answering questions live. To get us started, though, while you do bring those questions in, we do have a few that were pre-submitted. So we will go ahead and start with the first one. CJ, I'll ask this to you, and you can spread it around. What is the biggest challenge that UD EMS has seen in the 2021 school year and beyond?
I would go ahead and say that this probably starts way back in March when we were sent home. We had just gotten a new group of students certified, and they lost a lot of call experience in the months that we were sent home. This has created us to really come up with more training opportunities for everybody. And other than that, it's been really just kind of adapting every single day to the new situations that COVID's putting us in. I think some other people have some stuff to say too, but that's what I would say is the biggest challenge.
Eric?
Yeah, I would just say the biggest challenge that we've been faced has been COVID, and all of the other challenges that we've had this year have been kind of a result from that. So it's just been kind of adapting, and because it's not a typical year for us this year. So I'd say that would be our biggest challenge this year. And moving forward beyond that, I would just say that it's just going to be the repercussions of that. So it's just training new members and all of that kind of stuff that has been affected as a result.
Julia, Chloe, or Bailey, anything else to add to that?
I think they hit the majority of it.
All right. So we just had a question come in. What do members tend to major in, and what do they tend to do post-grad? And we can kind of loop this in with another question we have is, what do we do to make sure we increase diversity? So let's hit that one first. What do we do to increase diversity, and kind of touch on what majors we tend to bring in, and then what do members do post-grad? So CJ, if you want to start that off.
Yeah, we start our recruitment process pretty much the first or the second week that freshmen come into UD. We visit all of the ASI introductory classes outside of just your bio and your chem and your pre-med majors. We visit the businesses, the engineering. So we're just trying to make students who maybe aren't medically oriented aware of what we do, and that this could be a great opportunity for them. Within that, we also accept, we've had members that are business and engineering and health science and economic affairs. We have all different types of majors here. Now, we are primarily pre-med and bio and stuff, but we do try to include everyone that we can. In terms of post-grad, that really depends. We have some students that are in a chemical engineering stuff. We have some students that go on to be paramedics and firefighters. We have some students that are looking more at the law enforcement side of things. And then we have students that go the PA and nurse practitioner and med school route too. So we really have a wide range of post-grad plans out of our members.
Julia, do you have anything to add to that, as your position is kind of working with alumni and keeping up with them?
Yeah, so a lot of our alumni also go into the business side of things. So we have a lot of local business owners, people in the administrative side of fire or EMS life. So they use their EMT and their degrees and go into the administrative side of EMS too.
Very cool. And I can kind of speak, personally to this. EMS kind of helped define what I want to do. Currently, I have a computer science job, but have decided to volunteer for a fire department. And that's all because of being part of EMS in college. So a lot of people, like they mentioned, do go on to use it in some way, shape, or form after college. Going on to the next question, Eric, this will be for you. Have you seen any difference in the type of calls that you guys respond to due to the COVID-19 pandemic?
Right. So for this question, I would say that the types of calls that we have been receiving hasn't really changed at all. The amount of calls that we've had related to COVID has actually been pretty scarce. But I will say the biggest difference as a result of COVID is we've seen a lot more medical type calls in our total calls that we've had, and we've had a huge decrease in trauma. I would guess that's probably because a lot of us are kind of quarantining, hanging inside a lot more. People aren't out and about as much. But last month we had close to about 60% of our calls being medical. And this month we're still riding at like 80% of them being medical. So I would say that's the biggest difference. But in terms of COVID itself, we haven't really seen a huge impact of COVID running our calls.
John, you're still muted.
Oh, good call, of course. Does anybody else have anything to add to that? Nope. Okay. Well, we got a bunch of questions coming in. So this one will kind of be for all of you guys. So if you each want to take a turn, what do you think is the biggest skill that you have learned from EMS that is helping you now in school and that you can take with you post-grad? So CJ, if you want to start, I'll just kind of go down the line.
Number one thing I've learned is you really cannot expect anything when you show up to any sort of call. It's really taught me to be adaptable. I'm typically a very plan ahead person. I like to be pretty meticulous in what I do. And my very first couple calls that I ran as a promotion candidate, I showed up and everything was spinning around me, and I really needed to play things as it came, and I couldn't really plan ahead. So I think being adaptable and flexible is the biggest skill I've learned.
Very good. Julia?
Yeah, so I think this has really increased my teamwork skills and really taught me to delegate and rely on my teammates and not try and like accomplish everything myself, but to work as a team, and multiple heads are ultimately better than one. So.
Very good. Chloe?
I would say along with teamwork is being able to apply constructive criticism. None of us really like to be criticized, but it's really helpful when it's coming from one of your peers, and being able to apply it and take constructive criticism, whether that's on another call or just when you go to a different work or employment, is being able to handle constructive criticism in different settings as well.
Very good. Bailey?
I think like willingness to learn, especially as a younger member in the organization, you're always learning new things. And I think there's ever a day you're not learning anything as an EMT, you're a bad EMT. You're always learning new things and trying to adapt to a situation better.
And Eric?
I'd say the most important thing that I've learned from EMS is just general people skills, which kind of encompasses everything that everybody was saying. Like that goes teamwork with the people on shift, and also being able to communicate and talk to patients and give the best care that you can. But that extends to all aspects of life, in my opinion. So I think that's been the most important experience that I've seen.
Very good. Those are all great answers. Let's see. We got a bunch of questions. CJ, what is UD EMS's relationship with DFD? Do we have a mutual aid agreement? How do we work with them?
We have a really interesting relationship with DFD. One of the important parts of our training is we have to have clinical observations of current care providers, and that does not include us. So we have to be able to shadow along with paramedics and ALS providers, or advanced life saving. So when we're all going through our certification process, we all spend between 20 and 30, maybe 40 hours shadowing Dayton Fire Department paramedics and seeing them respond to calls and learning from them. So from an educational standpoint, they're very influential in helping us learn what we need to do. And then also from a mutual aid agreement, they will sometimes show up to UD's campus if there's a call that we can't handle. For example, a couple weeks ago, there was a pretty bad car wreck on campus, and they were worried about an extrication. And we don't have the ability to cut car doors off and pull somebody out of a car. So Dayton Fire responded to that one. So our mutual aid is essentially, if we're on a call and we get another call, they'll show up to it. Or if there's a call that we physically can't handle based on the materials that we have, they'll show up. But other than that, we're in good standings with Dayton Fire, and we use them a lot, and they're very influential in our training.
Very good. Chloe, I'll answer or give this one to you next as a crew chief. If you have to take somebody to the hospital, do you guys go to Valley or Kettering Medical Center?
Miami Valley is our home hospital, so the majority of our calls do go to Miami Valley. However, if a patient requests to go to Kettering, we can go to Kettering, or certain other calls we will. So a lot of our psychological calls we will take to Kettering. So it really depends on location and type of call, but the majority of our calls do go to Miami Valley.
Awesome. Thank you. This is for all the seniors on the panel. What are your post-grad plans, if you have any? I hope you have some sense of them. And have anybody's plans changed throughout their journey at UD as a result of being part of UD EMS? So Eric, we'll start with you on this one.
Yeah, absolutely. So after graduation, I do plan on getting my paramedic license, and I'm taking a gap year and potentially applying to medical school or some other type of post-grad school after that. And I will say that my plans definitely had changed as a result of EMS, because I never considered taking a gap year or anything like that. And after EMS and realizing that I love EMS so much, that I'm going to take the time to get my paramedic license as well.
CJ?
Mine definitely changed. I've always wanted to go to medical school. I'm currently in the application process, but I was pretty much dead set on orthopedics. I've been a baseball guy all my life. I really like orthopedics, but after working with EMS, I've become much more interested in emergency medicine and spending time in the ER and working with EMS agencies. So my plans haven't really changed, but maybe the actual specialty that, fingers crossed, I get in somewhere, maybe my specialty will change.
Julia?
Yeah, so mine have actually changed a lot. I started Dayton as an engineer and joined UD EMS as an engineer. And then doing clinical time, I really loved being in the hospital setting and loved doing patient care. So I changed my major to biology, and I've kind of explored every medical practitioner role, and I'm currently in the application process for accelerated nursing programs. So that's where I'm going.
And Chloe?
So I will be going to PA school. I was recently accepted, but the path of my journey kind of changed a little bit. I was originally in bio for 2 years, and kind of talking with other members, I realized that the health sciences department was a better fit for me. So that is my route.
Very cool. Thank you, guys. All right, Bailey, this one is for you. It's a very, very important question. Is the EMS house stocked with food while you were on shift?
So it can be if you bring your own food to shift. We have a fully functioning kitchen. So if you bring your own food, you're welcome to cook on shift. And then we also have the ability to drive in the ambulance off campus and get food somewhere else if the need should arise. So yeah.
Awesome. Thank you, Bailey. All right. So we got 2 more questions, it looks like, unless some more come in. I'll kind of open this floor to anybody who wants to take it. Is it hard serving your peers in an emergency medical way? You know, you kind of see them potentially on their worst day. So is it hard kind of maintaining that professionalism around people you may or may not know?
I would say that it definitely creates an interesting dynamic, especially if it's someone that you know. It is a little bit difficult, but it's also kind of an interesting dynamic too, because our goal is to provide care for these patients, but also be kind of a rock for them. Give them this sense of stability when they're in a really scary or unstable environment. So although we try to keep things as professional as possible, I think sometimes showing that we're human too, and we're trying to make sure that they're okay, and that's our whole goal. Can both turn a stranger into a little bit of your friend, and turn someone that you know into this potential new friendship afterwards, or just keep it professional and provide the care. So it's really a situation dependent, but I would say yes, it's pretty difficult.
Bailey, as a new member, did you find this as something hard to kind of adjust to?
Yeah, I mean, there's still times where it still is a struggle, you know. Some people you'll see in class, you'll see the next day on a call, and that can be a very eye-opening experience, and it can create a difficulty in providing like functioning patient care, but you get better at it, and it's a skill you develop, and eventually you become a better medical provider.
Eric, Julia, or Chloe, do you guys have anything to add what these two have said?
I can add that I think sometimes it does help too, to our advantage, that we're their peers, because we can be relatable and kind of they can trust us a little bit more than they might trust a stranger who's 50 years old and doesn't understand what they're going through. We can be a relatable resource for them.
It's very true. Anything else to add?
Yeah, just kind of touch on that. I think that it's also very beneficial that we see a lot of our peers, because it kind of allows you to not only the trust for patients, but it also helps for us in order to like remain professional in certain situations. It kind of gives us that skill. So it's just something that we have to adapt and learn. But yeah.
Very true. Chloe, anything else to add?
I would say it kind of helps us gain perspective, is like someone previously said, like we do sit next to our patients in class, and while we're sitting in class, we may not know what someone else is going through, and then see a little bit more into their lives on a call. So I think not even just on shifts, but realizing that not everyone's life is sitting straight up smiling in class, but realizing that everyone's going through something. So I think that by working with our peers, it's kind of helped me gain perspective of things going on in my age group's life that I might not see otherwise.
Very true. And for those of you out there that might not be in medicine or emergency medicine, there is HIPAA rules, so that keeps everybody from disclosing any patient information they may see on a call. So it's another kind of unique challenge of having to, understand how to keep that information private amongst your peers, especially if a patient may happen to be your friend. So last question, I know it's 12:30, but we will hit this quick. We'll start with CJ. What kind of support does UD EMS need from alumni?
I think one of the best things that we can get from alumni is experiential support. We have a lot of alumni come back and want to help us with continued education lectures if they're in the emergency medicine field or if they're in medicine in general. Some of them like to provide us with volunteer opportunities at different hospitals. But in general, we've definitely been struggling recently with a lot of the projects we're trying to get done. We're currently trying to afford and working towards affording the capnography for our life pack. And essentially, to put it very, very concisely, that is a way to monitor a patient's airway with a very, very meticulous detail, be able to look at how much carbon dioxide they're blowing off and make sure that they're breathing effectively. And that's a pretty expensive addition. And with the COVID budget, we've been struggling to do that. But other than that, the experiential stuff is really important for us too. And that's a great thing for us to get from alumni.
Eric, you're in charge of kind of the equipment and maintenance. Is there anything you see that alumni could help support you guys with?
Yeah, so really, especially this year, training new members with our during COVID times, like we've had a lot of training equipment that has a tendency to get pretty beat up because they get used fairly often. So for those who are maybe in a medical field or involved in some type of, or have access to some kind of equipment, if there's any like old equipment that could be potentially donated or something like that, that would be fantastic.
Yeah, and Julia, since your position is working with alumni, as noted earlier, do you have any kind of closing thoughts on this question, how alumni might be able to help UD EMS?
Yeah, I think CJ and Eric really touched on a lot of it, but I will just say if any alumni have questions about how they can specifically help us out in any way, feel free to reach out to me or any of our other officers, and I can kind of help direct you with what might be the most helpful for our organization.
Awesome. Well, with that, that is going to close our discussion for today. So I'd like to thank all the EMS representatives here for their open and candid discussion. Do you guys have any last insights for anybody that's watching that you would like to share?
I would just say that for those alumni that potentially were in EMS or have been interested in EMS, we love hearing from you guys. So please don't hesitate to reach out to us, or if you're in the Dayton area, potentially even stop by the house. We love to hear from you guys. We love to hear how everybody's doing, and we just love that stuff. So don't hesitate to do that.
Anybody else?
We love talking about EMS. So if this discussion has prompted you at all for some more questions, we could talk to you for 3 days straight, probably. So all of our officer emails are listed on the UD EMS page on the Dayton website. If you do have any questions, curiosities, or anything, please feel free to reach out, and we're more than happy to talk to you about it. And if you're in the Dayton area and you want to tour the ambulance or the house, just knock on the door and we'll be happy to do it.
And with that, I think that is our discussion. So thank you again for everybody who's here, and go Flyers.